Kalonchi.
Mm. What don't happen? This is like 30 seconds. I'm not being at Chomoko.
Yeah, no, no. Bakana.
Okay. Yeah, it's better than the.
So, kalake maranka. So, kalake maranka. Do you like it like this?
Yeah?
You like
Yeah,
it
it's
like this?
okay. It's
Or
okay.
I should bring it down?
No, it's okay.
So, when you're by the side, you're supposed to be in the front. Sit down in the middle.
Because all right. Welcome, Saraj Abdullahi. Let's join, please. So when you join, please write morning, sir, and write your name. Saadat is here. Bashir, Shirafat Bashir is here. So we only have three people. We need more people to join before we start. Okay. That's almost 50 there. Because as I said yesterday, I will take attendance at the beginning and at the end of each lecture. Because some people will just decide to join and then leave. Right? So I'll take at the beginning, at the middle, and at the end. So that we ensure that everybody participates. So we only have 11 people so far. Let's give some time for other people to join. Then the video of the lectures yesterday is on the YouTube channel AY Diabetes Doc. So for those who miss one or two things, you can go to the video and watch again. It's about an hour long video. Okay, Lucy is here, Omar Gombe is here, Rebecca Isa is here. Welcome. Ashat Ibrahim is here. So we only have 15 people so far. We need more to join, but I will start. I need at least, at minimum, 60 to 70% of the class to be here for us to start. This is just, the number is not there yet. Mariam Saleh Abdullah is here. Okay, we still have 18 people. I need more numbers. Class rep. Okay, we have 22 now. Very good. Just write your name for attendance if you are joined so that I'll know. We have Abdullah Yakuba has joined. Okay. 22 people are here. We need more numbers so that we can start. So today we'll continue with where we stopped, but I need more numbers, right? So that I will have the justification to start, so that there won't be any excuse. that I wasn't in the class when you gave the lecture. At least we'll give enough time for everybody to join. We still have 21. I need more numbers. Okay, now it's 27. I need more numbers. At least 60% of the class. I need at least 30 something for me to begin. Those who haven't subscribed, you teach them how to do that to join. So Amin Abdullah is here. Nuruddin is here. Okay. Faris Anufu is here. Good morning. Okay. I need more numbers to begin. My time is going. Anybody that miss anything will not tell me, come back, sir. Come again, sir. That is not going to happen. Okay, so I have 34. Let's begin. All right. So yesterday we started discussing the complications of diabetes, and we discussed the microvascular complications of diabetes. And we have discussed retinopathy, and we have discussed neuropathy. So today we'll continue our discussion with nephropathy. That means when diabetes damages the kidney. This is one of the major complications of diabetes, actually, and is one of the major cause of CKD, chronic kidney disease. Is one of the major requirements for dialysis and kidney transplant. But diabetes does not cause kidney damage all of a sudden. It usually starts gradually, right? So it starts with the kidney leaking protein. So the sieve, right, area that is in the kidney, diabetes will destroy it, and the kidney starts leaking protein. So when the kidney starts leaking protein, that's the earliest sign that diabetes has affected the kidney. So that is the major way we screen people for kidney damage. We do urinalysis. We are looking for protein in urine. So subsequently, the leakage of protein in urine increases. Later, it leads to chronic kidney disease, and later to end-stage kidney disease. So it starts gradually from leaking of protein, small, that's we call it micro albuminuria, albumin. So small of albumin leaking in urine, micro, small, albuminuria. So microalbuminuria. So from small leaking of protein, it goes to large leaking of protein. So that one will become macroalbuminuria, macroalbuminuria. So from that, it leads to chronic kidney disease, and if nothing is done, it leads to end-stage kidney disease. So how do you know that individual has started having kidney disease? One of the major way you know it is passage of frothy urine. So that means if somebody is passing urine, it will be foamy. It will be like foam, like the way you wash cloth detergent and it's foamy. So first way sign you know that somebody has started developing problem with the kidney is foamy urine. The urine will be foamy. For those who use the water system, if you pass urine inside the toilet, it will be foamy. Even after flushing it, it will still be foamy. It's a sign that that individual has problem with the kidney. If it progresses, if nothing is done and it progresses, the next thing is body swelling. So the individual develops body swelling. The face will be swollen, the legs will be swollen, and subsequently, if nothing is done, patients start having decrease in amount of urine they are producing. And subsequently, the individual will be told that the kidney is not functioning and cannot filter harmful substances in the blood. So at that time, they will say the individual needs dialysis or he needs kidney transplant. So you can see that diabetes affecting the kidney is a serious problem. So let me give the summary again. So diabetes can affect the kidney. An affectation of the kidney is not sudden but gradual. It starts with the leaking of protein in the urine from small amount microalbuminuria to large amount of protein leaking in the urine macroalbuminuria. Then later the kidney start to have decrease in function, and subsequently the patient may require dialysis or renal transplant. So what investigation will you ask for? You ask for urinalysis, you ask for UCR, urea electrolyte and creatinine, you ask for the scanning of the kidney. So that's the test you will do. Okay, so that is just the summary of how diabetes affects the kidney. So if you understand the topic, right, proceed. Let's go to another chronic complication of diabetes. If you understand the how diabetes affects the kidney, right, proceed. Let's go to other complications. We have, okay, so Hassana said proceed. Thank you. Okay, proceed. Memuna said, all right. So for the next issue is diabetes can damage the big vessels. So if you have damaged the big vessels, it can cause no, Abila, you joined the lecture late. For those who join late, you cannot ask me, you cannot say you did not understand. You have to watch the video after the lectures. So it can affect the big vessels. And how does it affect the big vessels? It can cause stroke if the blood supply to the brain is reduced. It can cause stroke, right? Diabetes can cause heart attack. So that's how it affects the major vessels. Diabetes can cause leg pain if blood supply to the leg is affected. So stroke, heart attack, leg pain. So these are the chronic complications. So, and if a diabetic patient develops heart attack, it used to be a very serious heart attack because the way diabetes causes heart attack is different from other causes of heart attack. So this one I will not go too deep for you. Just remember, if it affects the big vessels, it can cause stroke, heart attack, or myocardial infarction, and also peripheral vascular disease, that's leg pain. If it affects the vessels of the leg, it causes leg pain. We call it peripheral vascular disease. All right. So these are affectation of the major vessels. Okay. So we will try and speak things today because today the main thing I want to cover today is management of diabetes. So the main thing I want to discuss today is management of diabetes. And the major thing we'll discuss today is dietary management of diabetes. Okay, so the main thing we are going to discuss today is dietary management of diabetes. So let's begin. You know, there's a lot of misconception about dietary management of diabetes. Sometimes I've seen my patients being told that the only thing they can eat is beans, acha, wheat, which is a strong and serious misconception, and it should not be coming from any of you. It should never come from any of you, and that's the purpose of this lecture. Because for you to counsel any diabetes patient on diet, you need basic knowledge. So pay attention. So the major thing about dietary management of diabetes is every diabetes patient must stop simple sugars. Simple sugars are majorly monosaccharides like glucose, fructose, and some of the disaccharides that are easily broken down, such as sucrose, which you get in your table sugar, and other ones. So every diabetic patient must stop refined sugars. What are the sources of refined sugars? We have sugar, honey, soft drinks, all these tea things that you use to do tea that have sugar, right? So all those ones must not be used, right? All these, the ones we know. Those who don't have diabetes can take it, but those who are diabetic cannot take Milo, Bonvita, Ovaltine, cannot take ice cream, cannot take cake, right? Cannot take white bread because white bread has a lot of sugar. So the first thing you are supposed to let a diabetes patient know is that he cannot take refined sugars, either monosaccharides or disaccharides that are easily broken down, right? Okay, so what we use to determine what a diabetes patient can take is called glycemic index. Glycemic index and glycemic load. Let me see if I can type it for you. Okay. All right. Glycemic index. Then glycemic load. So you will see. So the main thing that determine, you can see my right up there, glycemic index, glycemic load. This is what determines what and how a diabetic patient should eat. Okay, so for glycemic index, what it does is that it's a ranking system that measures how rapid a food item increases the blood glucose and to what extent. I'll repeat it. Glycemic index is a ranking system that measures how rapid a food item, let's say rice, elevates the blood glucose and to what level does it elevate the blood glucose level. So that's glycemic index. So what glycemic index does is that it compares 50 gram of that food item with 50 gram of glucose. Why are we comparing with glucose? It is because glucose has the highest glycemic index of 100. Glucose has the highest glycemic index of 100. So you're comparing any food item with glucose. So, and glycemic index is graded into low glycemic index, or otherwise you can interchange it like low sugar food, moderate glycemic index, moderate sugar food, and high glycemic index, high sugar food. And know very well that refined sugars that I earlier said a diabetic patient cannot take have high glycemic index, or they are high sugar or high glucose food. So it is important that every one of you should know the food in your locality and their glycemic index. Because the idea that some of you have that a diabetes patient can take a lot of beans because it has no sugar is not true. Because 58% of beans is sugar. So beans has moderate glycemic index. So you can see it is important for all of you here to know the glycemic index of food in your environment. Okay? So it is very, very important to know. I can see the attendance is only 27. Where are the rest? I told you I'm very serious. Those who do not attend the lectures, though may not be allowed to write exam, but they will not get any bonus mark, even if they fail. So let's continue. So you need to know the glycemic index of the food in your environment. So, um, so any food item that has glycemic index of less than or equal to 55. Let me repeat, less than or equal to 55. It is low glycemic index that I earlier said. If it is between 55 to 69, it is moderate glycemic index. If it is up to 70 and above, is high glycemic index. Let me repeat. Though it is in your note, you see it. If you have the note, you see it. So you can read it later, but here you pay attention. All right. So if it is less than 50 or equal to 55, it's low glycemic index. If it is 55 to, if it is 56 to 69, is moderate glycemic index. If it is 70 and above, is high glycemic index. So let me give you example of things that have low glycemic index. So generally speaking, vegetables, especially leaves, have low glycemic index. So leafy vegetables have low sugar content or no sugar content. Secondly, a lot of protein have moderate glycemic index, so moderate amount of sugar. Okay, so moderate amount of sugar. Then and other ones have high glycemic index, that means high amount of sugar. All right, so vegetables have low glycemic index. Protein have moderate glycemic index. Then carbohydrates generally have high glycemic index. So vegetables, low glycemic index. Protein, moderate glycemic index. Carbohydrates, high glycemic index. But it's not a hard and fast rule because there are proteins that have low glycemic index and there are some proteins that have moderate, but generally speaking. So it should be your personal assignment. Go home and check articles that study glycemic index in the north of food in the north and see which one has high glycemic index, which one has moderate, which one has low. It is important for you because that's what will help you to counsel your patients. Okay, that's what will help you to counsel your patient if you know the glycemic index. All right, so then the next thing is the glycemic load. Glycemic load has to do with the glycemic index times the number of gram, is the number of gram in the food. So if you have a plate of food, right, what is the gram of the whole food? Maybe is it 150 gram? Then you times it with the glycemic index. Let me give you an example. Let's say you want to eat rice and the total amount of rice in your plate is 150 grams and the glycemic index of rice is 75. So what you will do is 150 times 75. So the number of gram times glycemic index will give you glycemic load. The number of gram of the entire food times the glycemic index of that type of food will give you glycemic load. Hope we are following. So generally what we advise is that if the food item has high glycemic index, the quantity should be small. That's the rationale. So if somebody wants, a diabetic patient wants to eat rice, because rice has high glycemic index, the quantity should be small. But if it wants to take vegetable, because vegetable has low glycemic index, the quantity can be a lot. That's why we advise diabetic patients take small food like the size of your fist small carbohydrate, small protein, and a lot of vegetables. So that's why we counsel diabetic patients on that. But let's make this meeting more interactive. Okay. So is to if somebody is going to take let's say rice and white bread, between rice and white bread, which one has higher glycemic index? Type it in the comment. Rice and white bread, all of them have high rice and white bread, but between rice and white bread, which one has higher sugar content or higher glycemic index? Okay, Abila wrote rice. Who? Somebody else. Rice and white bread. Which one has higher sugar content? Okay, Memuna wrote the rice too. Okay, who else? Rice. Laraba wrote rice. So surprising enough is white bread. White bread, good. Rashid Abubakar wrote white bread. Exactly. White bread has almost very high glycemic index like table sugar. So white bread has very high glycemic index, very high sugar level. Okay. So next question. Between your table sugar, your sugar that you use to take tea with, and honey, between table sugar and honey, which one has higher glycemic index? Between honey and your sugar, which one has higher glycemic index? Between honey and your table sugar, which one has higher glycemic index? Okay, so that is a sugar. Abila said table sugar. Okay, what else? Okay, Abdul said table sugar. Okay, for me says, but surprisingly enough, honey and table sugar have the same glycemic index, meaning the way sugar will raise the blood glucose. That's the same way honey will raise the blood glucose. That's why diabetes patients are prohibited from taking honey. So they have the same glycemic index, right? So that you can see that having information about the glycemic index of food in your environment is extremely important. So, next question, are we ready? Between tuwon masara, between tuwon maize and tuwon millet, tuwon dawa, which one has higher glycemic index? Between maize swallow and millet swallow, tuwon masara and tuwon dawa, which one has higher sugar level? Write in the comment. Okay, Abila wrote tuwon masara, yes, maize. Yeah, very good. So it's maize, right? But both of them have high glycemic index. Don't forget it. Both of them have high glycemic index, but among the high glycemic index, some are higher than the other. But very important, remember, a diabetes patient can eat any tool. We don't want it to be too processed. That's the most important thing. And nika masaran data, koda one data, they should not remove the bag. Cut a surfer. Any tool a diabetic patient can take it. It is the quantity. It should be like the size of their fist, or one wrap of one serving. Restaurant serving, not home serving. Because some of you here, I know if you are to take two, it would be very big too, isn't it? So it would be one serving. Okay, so that's very important. So any diabetic patient is not prohibited from taking any kind of swallow, but what matters is the quantity. Small quantity with a lot of vegetable soup. Very, very important. So if you understand glycemic index, glycemic load so far, write proceed, or if you have question, you write the question. Let's give 1 minute. If you have question, write it. If I can proceed, then document proceed. Let's go. Okay, so proceed, proceed, proceed. Let's say more explanation. No, you have to say where you want the explanation. Okay, proceed. All right. So the next thing about diet is fruits. Fruits are very important. There are fruits that have very low glycemic index, no sugar at all. There are fruits that have moderate glycemic index, and there are fruits that have very high glycemic index. But you should note that fruits, the more ripe a fruit is, the higher the glycemic index or the sugar content. Okay? So let's give example. Like if you talk about mango, right? You talk about pawpaw, you talk about pineapple. These ones have very high glycemic index. But for mango, there is some condition attached. If the mango is not very ripe, the patient can take small. But while once it's ripened, you will have very high glycemic index, and every diabetic patient is not advised to take. If you talk about pawpaw, there's also small condition there. So if it is pawpaw, if you talk about pawpaw, if it is slightly unripened, so if you meet it while it's still crunchy, right, the diabetes patient can take small. Okay, but generally, ripe pawpaw, pineapple, and mango should not be taken. Then there are some that have high sugar content, but the diabetes patient can take small. Like orange, can take one a day. Banana, you can take one a day. Apple, we prefer green apple. You can take two a day. Why do we prefer green apple? Because it has more fiber and less sugar. But if it's the red apple, you can take one a day. Then there are fruits that have low sugar content. For example, avocado pear that they find in Jos. Avocado pear has less sugar content, right? Then you talk about garden egg, yellow, has no or less sugar content. Cucumber, right? Also have less or no sugar content. Then you talk about nuts. What are the nuts that very good? What are fresh tomatoes? Also, fresh tomatoes have low sugar content. So for people that like taking fresh tomato, this is superb. But tomato, we regard it as vegetable. All right. And I said you can take a lot of vegetables such as cabbage, lettuce, cucumber, carrots, tomato, eggplant, right? So you can take a lot of vegetables. So for nuts, there are nuts that don't have sugar, like cashew nut, not the cashew fruit. Cashew fruit has sugar, but I say cashew nut has less sugar. Then you talk about almond nut. But for granite, though it has less sugar, but the oil, granite oil, has a lot of cholesterol. So we prefer kuli kuli or karago than granite. But if the diabetes patient can take granite, it should not be more than handful, like 100 naira granite. Okay? Then we talk about very good Mimuna and say watermelon. Watermelon has a lot of sugar content. So a diabetes patient can just take small, like 100 naira watermelon, but not a lot. Then so for granite you can take small, but for quickly they can take more. Okay? So this is the general summary on diet. If it is real food, take small. carbohydrate, small protein with a lot of vegetables. And no, for protein, no red meat, only white meat, chicken, fish, turkey, guinea fowl, duck, agwagwa. So generally, these are the ones a diabetes patient should take. No red meat. Why don't you want red meat? Because of the cholesterol. Then you talk about oil. I'll give you the different oil that we have and which one is the best. Generally, olive oil is the best oil for everybody, whether you're diabetic or not, because it has the least cholesterol. Uh, it has the least cholesterol, and it has omega 3, omega 6. Okay, Abila, I talked about leaf now. I said leaf have no sugar content, so they can take a lot of leaf, right? Especially if they are taking swallow, they can take with vegetable soup like ugu, spinach, yakwa, karkashi, ayoyo, ramma, okra, fresh okra. There are a lot of leaf. So any swallow they should take with a lot of leaf. Okay. So for oil, the best oil is olive oil, followed by any other vegetable oil, followed by palm oil, because palm oil still have cholesterol. Because I've seen videos of misconception that palm oil is better than some vegetable oil. It's not true. So palm oil, you have olive oil, other vegetable oil, palm oil, then groundnut oil. Groundnut oil has a lot of cholesterol. Then the last one is animal oil, like manshanu, right? So it has a lot of saturated fat and cholesterol. So that's how you classify oil. And oil should be small. So you should not cook like the Yoruba people. No offense to the Yoruba people in this class, that they put a lot of oil. So for a diabetes patient, you advise them to take put just small oil, right? So this is general discussion overview of diet in diabetes. If you have question, please state it. Question on diabetes, dietary management. Question on dietary management of diabetes. If you have question, please write it down. Any question on diet, because you as my students, I don't want a situation where the misconception will be coming from you. So if you have anything about diet that you're not clear about, please ask now. The floor is open. Any question on diet? The floor is open. Memo, okay. Okay, Esther Adamu asks, how about wheat? I told you that any swallow they can take it, whether it's wheat, is masara, is millet, whatever they can take it. Just if whether it's wheat or it's acha or whatever it is, you take small with a lot of vegetables. So whatever type of swallow they can take it. All we want is that they should not over process it. Kar su surfa, su nika data, so that when they're eating, they will feel the fiber. As I say, fiber helps to reduce how rapid glucose is absorbed. So though it's very important that the fiber should be felt, all right? The dosa should be felt, the chaff. So what about banana? I said it now that banana has high sugar content. So it should not be more than one banana in a day. Okay. So Sherifat asks, how about sweet potato? Very good question. So the sweet potato um, is has low glycemic index compared to the Irish potato. So though the sweet potato is sweet, but it has a lot of fiber. For those who eat sweet potato, you remember that sweet potato have a lot of fiber. So that fiber limits how rapid the sugar level, your blood glucose level will go up. So we prefer sweet potato to Irish potato. Good question. How is this glycemic index, glycemic load measured? But I have stated it now. You can check your note after the lecture, or you watch this video again, you see where I've discussed it. I've discussed this in detail. Siraj Abdullahi asks, what of sugar cane? Sugar cane is what you use to make table sugar. So if it is what you use to make table sugar, right? Will you advise somebody to take sugar? You cannot take sugar cane if you are diabetic. This is prohibited now. Totally not allowed. Okay. Any more question? Any more question? So we'll talk about exercise, but before then, let's answer some questions on diet. If you're ready, write ready, sir, ready, sir, ready, sir. Get your paper and pen. Let's answer some questions on diet. If you're ready, you write ready, sir, ready, sir, ready, sir. If you're ready for questions on diet, write ready. Okay, Memuna wrote ready, sir. Okay, ready, sir. Lois. Okay, Umar, ready, sir. Okay, so first, number one. Okay. Abila asks, why are we always avoiding cholesterol? The reason why diabetes patients should avoid saturated fat that have high cholesterol is because when you have high cholesterol, it blocks the blood vessels that supplies the heart and the brain. So you're at risk of stroke and heart attack if you don't make sure you do that. You're at risk of stroke and heart attack. Okay. Manshanu, that's the animal oil, animal fat. I said manshanu has the highest cholesterol. So let's go ahead. Let me not be repeating myself. Okay, no, maize, you don't soak it in water before that. You just wash it, spread it for it to dry and go and grind it. Don't soak it in water for long. It's not the right way to prepare it. So, why, number one, why does sweet potato have lower glycemic index than Irish potato? Number one question. Why does sweet potato have lower glycemic index than Irish potato? Why does sweet potato have lower glycemic index than Irish potato? Okay, so A, because sweet potato is bigger. Because sweet potato is bigger. B, because sweet potato is more natural. B, because sweet potato is more natural. C, because sweet potato has more fiber. C, because sweet potato has more fiber. D, none of the above. D, none of the above. Let me repeat myself. Why does sweet potato has low glycemic index than Irish potato? A, because, okay, so Abila has even written the answer, okay? So the answer is C, because sweet potato has more fiber. Yes. So that you also wrote it. Very good, because sweet potato has more fiber. Very good. Very good. Very good. Okay, that's more fiber. Very good. Very good. Very good. Very good. More fiber. Very good. Very good. See, all right. Okay, so let's answer another question. You people, you all got this right. Okay, you all got this right. Okay, so the next question is The next question is, how do you classify the glycemic index of beans? How do you classify the glycemic index of beans? How do you classify the glycemic index of beans? A, high glycemic index. B, moderate glycemic index. C, low glycemic index. D, it no glycemic index. So, how do you classify the glycemic index of beans? A, high glycemic index. B, moderate glycemic index. C, low glycemic index. D, none of the above. Let's just put none of the above. I will not confuse you. So, glycemic index of beans. Yeah, moderate. Very good. So the glycemic index of beans is moderate. That's why you don't tell diabetes patient to take a lot of beans. Because if you tell them to take a lot of beans, their sugar will go up. Because I met a diabetes patient that came to me and he has been following all the instruction that we have given. So why is his sugar high? I said, what's the instruction that you have been following? He has been taking a lot of beans. I said, I'm not the one that gave you that instruction, right? So if you are going to take beans, you should take small because it has, you should not take it a lot because it has moderate glycemic index and take it with a lot of vegetables. All right? Exactly. Exactly. So let's go to the next question. The next thing we'll discuss is exercise, but let's answer one more question on diet. Let's so the next thing we'll discuss answer the next question. Okay. Which type of food Which type of food is a diabetes patient not allowed to take? Which type of food diabetes patient not allowed to take? A, complex carbohydrate. B, protein. C, simple sugars. D, vegetable oil. So which type of food a diabetes patient is not allowed to take? A, complex carbohydrate. B, simple sugars. C, what did I say was C? Okay, simple sugars. Then we talk about, okay. Please, if you write the answer, write what you meant by that. So we talk about complex carbohydrate, simple sugars, fat and oil, protein. Okay, no, I said complex carbohydrate, protein, simple sugars, and vegetable oil. Complex carbohydrate, protein, simple sugars, and vegetable oil. So simple sugar, yes. So diabetes patient cannot take simple sugars. Very good. So when you answer, you write simple sugars. Very good, Fatima. All right. Okay. So you people have understood this very good, this lecture on diet. So I want to leave diet. I'm going to exercise. If you're ready with me, write proceed. If you have any question on diet, write the question now. Want to proceed to exercise. We want to proceed to discuss exercise. Uh, I want to make sure that we go further to I want us to conclude on diabetes today so that next week we'll be discussing obesity. Okay, so I've seen proceed. So exercise is very important for a diabetes patient, right? One of the major benefits of exercise to diabetes patient is it lowers the blood sugar level. It reduces the weight of the diabetes patient. It lowers cholesterol. It helps the diabetes patient to have good sleep. It lowers blood pressure. Let me repeat. Exercise is extremely important for a diabetes patient. Why is that? It lowers the blood sugar level. It lowers bad cholesterol and increase good cholesterol. By the way, bad cholesterol is the LDL. Good cholesterol is the HDL. So it lowers bad cholesterol, it elevates good cholesterol, it lowers blood pressure, it allows the diabetes patient to have adequate sleep. So you can see that exercise is very important for a diabetes patient. But how does a diabetes patient begin his or her exercise? Right? So exercise, we want a minimum of 30 minutes of moderate exercise. What are the examples of moderate exercise? Walking fast, riding a bicycle, right? Or walking on a treadmill, right? So all these are examples of moderate exercise. And the best I usually recommend for my patients is walking fast, right? So at least 30 minutes a day, 5 times a week. So the diabetes patient should have 2 days rest in a week. 30 minutes a day, 5 times a week, that means 2 days rest. Okay? So, but how does a diabetes patient begin that exercise? It is important before any exercise, if you have the means, if that patient has the means of a glucometer, should always check the sugar. Because if you start an exercise and your sugar is towards the low side, you need to eat something, a snack, before starting the exercise. Or if you start an exercise and the sugar is very high, you need to calm down and be careful with that exercise because it can cause problem. So you check the blood glucose before beginning any exercise. Apart from that, right, make sure that patient is well hydrated. And while doing the exercise, you should always have water. At the end of the exercise, it's also very important to check the blood glucose because I said earlier that exercise reduces blood sugar. So at the end, you check whether your blood glucose is going towards the low side. If it's going towards the low side, if it's time for your meal, you eat. If it's not time for your meal, you take a snack. So it's very important that each diabetes patient should do exercise. But before beginning that exercise, that patient should be reviewed by his doctor. Because if the diabetes patient has heart problem, there's limit to the exercise he can do. He has to do what we call graded exercise. If the diabetic patient has problem with vision, you cannot ask him to go out to the field to begin exercise. That will cause him problems. So if that patient has problem with the eyes, I ask the diabetes patient to go to the field and start running. There will be problem. The reason why there will be problem is because he may fall down or get injured. If the diabetes patient has problem with if a diabetes patient has problem with neuropathy that we discussed yesterday, so if there's neuropathy, abnormal sensation, that diabetes patient should get a very good footwear. That means the one that even if he matches nail or something, it will not pierce the the shoe to reach the foot. Right? And the shoe should not be too tight, and the shoe should not, and if he's wearing socks, he or she should wear pure cotton socks, right? So that's very important. Okay, so this is the summary about exercise for diabetes patient. If you have any question concerning exercise, please ask so that we can conclude with a single or two questions on exercise. But if you're okay, then you write proceed so that we answer question and exercise. If you're okay with the exercise, right, proceed so that we can answer one or two questions on exercise. Okay, I'm waiting. Do I proceed? Okay, Asana road proceed. Good. Who else? Okay, proceed. Sarajo road proceed. Okay, so let's answer questions on exercise. If you're ready, right, ready, sir, ready, sir, ready, sir. If you're ready to answer questions, right, ready, sir, ready, sir, ready, sir. Okay, okay, ready, sir. Lois road, ready, sir. Okay. Any other person? I want to see. Yes, Abila, you can ask them to get pedometer so that they will know the number of steps per day. But we, as specialists in diabetes, we are not more keen about the number of steps per day, but walking faster. Because somebody can be walking very slow and the pedometer will be reading it. So I prefer brisk walk, walking fast rather than walking slowly. Okay? So, ready, sir, let's answer. Okay, what is the minimum minutes of exercise per day? What is the minimum minutes of exercise per day? A, 20 minutes. B, 30 minutes. C, 40 minutes. D, 1 hour. Okay, so what is the minimum minutes of exercise per day? A, 20 minutes. B, 30 minutes. C, 40 minutes. D, 1 hour. So write the answers. Okay, Avila is there. 30 minutes, yes. Minimum of 30 minutes, exactly. Minimum of 30 minutes. Unless an individual has a health condition that will stop him from doing up to 30 minutes, the minimum is 30 minutes. Okay? Okay, very good. Very good. Okay. Then the second question, 30 minutes, yes. Hadiza. So, but if it is high intensity exercise, someone asks, is diabetes patient needs at least 15 minutes a day, right? 3 times a week. So if it is high intensity exercise, it's about 75 minutes per week. So it's just like 15 times 3, that's 75 minutes if it's high intensity exercise. But me, I don't generally recommend high intensity exercise for some of them because they get stressed. So I always recommend moderate intensity. But for those who can, they can do high intensity exercise of 15 minutes per day, 3 times a week. High intensity is vigorous exercise. So the next question is, which of the following is not a benefit for exercise? Which of the following is not a benefit of exercise? Which of the following is not a benefit of exercise? If you are ready, say ready, sir. Ready to answer the next question. If you're ready, write ready, sir, ready, sir. If you're ready, write ready, sir, ready, sir, ready, sir. Let's go there. Good. So I said, Lois wrote ready, sir. So let's go. Which of the following is not a benefit of exercise? A. Reduce blood pressure. B. Reduce bad cholesterol. C. Increase lack of sleep. D. Lower blood glucose. So which of the following is not a benefit of exercise? I said A. Reduce blood pressure. B. Reduce bad cholesterol. C. I said increase lack of sleep. D. Reduce blood sugar. So what is the answer? Abila, write, if you write the option, write the answer together. If you write the option, write the answer, please, so that others will benefit. Yes, I agree. The answer is C, but what is C? Write it. Abdul Rashid Abubakar Bibi. No, I said reduce blood sugar. I didn't say increase blood sugar. So the answer is C, increase lack of sleep, because diabetes exercise helps you to sleep. Increase lack of sleep. Exactly. Increase lack of sleep. Exactly. I said reduce blood sugar. I didn't say increase. Okay, increase lack of sleep. So exercise. If you remember, for some of you that do exercise, if you do some exercise in the evening, that allows you to sleep very well, isn't it? So it's not only beneficial for a diabetes patient, it's beneficial for everybody. Okay, so if you have any question concerning diabetes, because today we are concluding diabetes, next week, I don't know, class rep, what do you have tomorrow, 8 to 9? Do you have space or not? Do you have space 8 to 9 tomorrow or not? Because I want to just talk about the treatment of drug treatment, because some of you prescribe drugs to your patients. But if there is no space tomorrow, we'll leave it to next week. Is there space tomorrow? Lois, class rep, do we have space tomorrow? 8 to 9. While they are trying to find out if we have space tomorrow, please, if you have any question concerning diabetes, ask. If you have any question concerning diabetes, we will discuss diabetic drugs in our next lecture. We will discuss diabetes drug, but I will not go too much in detail, because I don't want you to be confused. So diabetes drug is the next lecture. So that's why I'm asking if we can get a space this week, 8 to 9, for the class rep. Okay, there's no space 8 to 9 tomorrow. When can we? Anyway, try and create a space 8 to 9 apart from any space you have. Please, the class rep should communicate to me whenever you have space 8 to 9. So if you have any question about the things we discussed about diabetes, please ask, or we call it a day. If you have any question, please ask. This is the last chance. I will not go back to the things I have taught you. This is the last chance. Any question on diabetes, apart from diabetes drug, which we are yet to discuss? I will not go back again. You have your lecture notes. If you have any, even though the lectures on the drugs is on your slides, you can start reading it before we we um we talk about it in detail. All right. Okay. Someone talked about weekend. No, some people take their weekend seriously. Oh, but anyway, you as a class should agree on that. Maimuna Saliu said, "Sir, I ask questions. Write the questions again. Sometimes I may jump some questions, so write it again." Maimuna Saliu Adam, write your question again. Okay, you're welcome. Sharifat, you're welcome. Lucy Chiroma. Thank you, Abilad. Very educative. Thank you, Abilad. Thank you for the comment. Sharifat, thank you. Okay. Maimuna, okay, also wrote thank you. Thank you too for paying attention, for being good students. Okay, thank you. Yeah, diabetes patient should check his blood sugar before and after exercise. If before exercise the sugar is already low, he should eat. And after exercise the sugar is low, he should eat. That's very important. So somebody is asking what causes the formation of whitish tissue. Whitish tissue, it can be two things. It can be necrotic tissue due to infection, or it can be part of healing process where the subcutaneous tissue is forming. So it depends on what you're seeing. It could be infection causing necrosis and dead tissue, or it could be subcutaneous tissue. But most of the time is uh, okay. So have a nice day, everyone. Take care of yourself. Thank you for. We'll begin with discussing diabetes drugs. So please come ready, come prepared. So at the end of this lecture, I'm only seeing 25 out of 50. I'm going to take my attendance with only these 25 people that are here. Thank you and have a nice day.